With all the ACL tears in the media these days, you might be wondering how the injury happens.
Let's talk about the most common ways the ACL is injured.
It's important to remember that you don't have to be a professional athlete to tear your ACL, and that most of these injuries occur with the same basic mechanisms. Let's start with non-contact ACL injuries. This is the type that we often see when an athlete is cutting, pivoting, sidestepping, or landing awkwardly from a jump and goes down clutching their knee. In many cases, you will notice that the foot may be firmly planted in the ground with the leg away from the body. The ACL will tear when the player transfers their weight and twists at the hips, causing a significant torque on the knee. We call this a dynamic valgus mechanism of injury. To give us one example of this type of injury, let's take a look at how Stu tore his own ACL in the 2013 Gold Cup. Research has shown that there may be several factors that may make certain athletes more susceptible to non-contact ACL injuries. Other factors that may put you at an increased risk include weakness in certain muscle groups of the leg, as well as the way you train. This has been illustrated through high-tech video analysis of athletes that have suffered these injuries. When it comes to contact injuries, the ACL tear will come as a result of a direct blow to the knee from another player or object. This is usually the type of injury that we cringe when we see on television. Depending on the situation, we may see injuries to other structures of the knee with this type of force. Now, these injuries are obviously more difficult to prevent, and when they occur, it's best to have a physician check you out as soon as possible. In either situation, when the ligament actually tears, the player often describes feeling a popping sensation in the knee and may have severe pain with difficulty moving or putting weight on the injured leg.
The reason you need an ACL is for stability of the knee, okay? And that stability usually comes when you change direction. So if you're a person in life who just walks forward and backwards and doesn't do any change of direction, at least at any rate of speed, you could get by without an ACL. However, when you're walking around after an ACL injury and you notice that your knee is sliding out of place, end of story, you need it fixed. And why is that? Because we want to prevent damage to the other structures in the knee. What we see 20 years after an ACL injury of someone that had an injury, did not get it reconstructed, and did not modify their activity is arthritis. Because without an ACL, you end up tearing your cartilage, which are the pieces of gristle between your bone. So without an ACL, your chance of having early arthritic change are high. So if you're athletic or you have any instability of your knee, you should get it reconstructed.